Hello everyone, you're welcome again to my YouTube channel, Cleft Lip with Femi, and today I have with me our matron. So she's a senior nurse in Lagos University Teaching Hospital, and today I'm so happy to have her with us on this episode, and she'll be teaching us all that we need to know. But before I go ahead, I want her to introduce herself first. Ma, can you introduce yourself to us?
Thank you. I'm Nurse Adekunle Omoyeni from Lagos University Teaching Hospital. I'm one of the members of the Smile Train Orofacial Clefts team.
Thank you very much, man. Thank you for coming on this show. So now the first thing I want to talk about is that many people, the mothers, when they give birth, you are the first person to see them as the nurse, as the midwife. What is your reaction? How do you convey this message to the mother?
Thank you. As a midwife, definitely we see this baby before the mother or the parent. So once the baby comes out like that, what we do is to allow the mother to identify the sex of the baby. Show the baby to the mother, ask the mother, what do you have? Baby boy, baby girl? Fine. Then the next thing is to show the face, because this is very important. You have seen the baby, you've seen the anomaly, you have to let the mother see the baby, and definitely you are ready for the reaction. So the reaction, definitely the mother will start crying or show emotional problem at that time. So what you do is to allay the fear and the anxiety of the mother. Tell the mother there's nothing about the baby. The baby is not abnormal baby as a normal baby. But because of the facial deformity, she should not worry. There are a way to do it. There's a solution to it. And you take the baby away for cleaning, for the baby to be sectioned, normal baby assessment, to see that there's no anomaly apart from the cleft lip or the palate. And the next thing, you invite the pediatrician on call to see the baby and to ascertain that there's no other thing that is happening or that is wrong with the baby. The next thing is to institute feeding.
Thank you very much, ma'am. So from that time of delivery to the time that the child has been given to the parents, so what are we now going to, what is the advice for the parents, especially on feeding, considering the fact that they have a cleft lip, especially when it is bilateral and also including the palate, there is tendency for difficulty in feeding. So how do we advise them? How do we teach the mother to feed this child?
Thank you. As I've told you, we have to deal with the psychological and emotional aspects of the mother, because some of them will not want to bond with this baby,
Yes.
because they are confused. Where did I get this baby? How did this baby
it at all.
comes to me? It's just like you have a hen, and the hen, you're expecting the hen to produce another hen for you. And when the hen lay egg and the hen wanted to hatch, now hatching that. You know how it feels? It's unexpected, because every woman, when you're pregnant, you are foreseeing that, okay, my baby will look like my husband, will look like my sister, or you understand? And now this comes out. So you have to talk to the mother. You have to work on the mother. Then you want the mother to put this baby to breast. The first thing is to check the mother's breast. Has she prepared the breast for the baby when she was pregnant? By cleaning the breast regularly, by molding the nipple, you want to check. When you have checked and the nipple is okay and she is ready to breastfeed now, we clean the breast and show her the position, because the positioning matters in this case, where she's going to tilt the nipple to the baby's mouth. And if she can tilt the nipple into the baby's mouth can, if the nipple can mold the lips. So we encourage her to breastfeed, as we know that breastfeeding is the best food for babies. So we encourage her to breastfeed. And sometimes we have difficulty for the mother to lactate. We encourage the mother to take a lot of pap and tea and make herself warm, so that this the milk can come out. And by her putting the baby on this breast, always the lactation will flow. Sometimes after doing all this, the milk will not flow. Then we have to introduce formula. And the formula we are going to introduce, we make sure it's having almost the same nutrients with the breast milk, so that the baby can have the required nutrients. So we advise them on that, and we show them how to feed the baby, so that the baby will not regurgitate or having aspiration.
Thank you very much. So for families or for a mother that have this kind of a child, what is your advice for them?
My advice for them is to bring them out. They should try and bond with the baby. Do advise them that the baby is a normal baby. The baby is not abnormal. The baby is not Ogbanje. The baby is not bringing any bad luck to the family. Bring the baby out, there is solution. And we thank God to the Smile Train. They are the NGO that takes care of this baby free of charge. Free. In Luz, we are taking care of them under the sponsorship of the Smile Train. It's free. Right from birth till when the baby can speak well, in case of the palate. We have different units that are together to manage these patients. And the good part of it is, if the baby is having just the lip, within 3-4 months, the surgery is done. The only problem that is there is the mother to be committed. She's not paying any money. Sometimes when we see that the parents, they cannot even afford to come to the clinic as they should, Smile Train give them transportation money each time they come to the clinic. So all what they need is to bring this baby at appointments, date and time. Once this baby is 3 months to 4 months and weighs 4.5, the baby will go to for surgery. The only thing we require of the parents is to take good care of this baby. Make sure this baby is not having no diarrhea, no vomiting, no temperature, and the baby has gotten his or her immunization as at when due. Once all this is done, these are all the criteria, and they have done the blood works, and everything is done. The baby is ready for surgery, and it's just 1 week. If the baby is 3 months or 4 months, weighs 4.5, and has met all these criteria, the clinic is on Tuesdays. Once the baby comes to the clinic on Tuesday, we admit them. Thursday or Friday of same week, the operation is done. And the next Tuesday, the baby is being discharged. And the next thing is for the baby to be coming for appointments for other necessary treatments. With all this, we are free of charge.
Thank you very much, Mama. Thank you very much. So now you have heard, please share this link with somebody that needs to know, because the reason for this channel is for awareness. Many people are not aware. Do you know somebody that knows somebody that has a child with cleft lip and palate? Please share this link. Let them comment on this section. Drop your comments, I'll attend to them, and then we'll give you all the information as you all require for it. Thank you very much for joining me on this session. And another good news is that we have this same session in Yoruba language for all the people that are Yoruba lovers. So it doesn't matter if you are literate or illiterate, it doesn't matter. This information is for everybody. So on my next session, please watch out for the Yoruba session of this our episode. Thank you very much. Don't forget to like, subscribe, and share the link. Thank you for coming, ma'am.
Yeah.
So I'll see you some other time.
Bye.